So we look at the concept where you always hear them talking about international normalized ratio, international normalized ratio, international normalized ratio. So what is it, right? What does it actually mean? So the international normalized ratio, is a standardized measure. So it's used to measure how long it takes your blood to clot. This is a formula. Okay, so if your blood is actually flowing out, how long will it take it to stop? So it's especially important for people that are taking anticoagulant medications like warfarin, all right, that help to prevent clots. So they're now they're trying to access that. Okay, if you are preventing clots, how about if you start bleeding? So maybe you can just be bleeding non-stop. All right, so the thing is, basically you are trying to measure how long it takes for somebody's blood to clot. So for how long it takes for somebody's blood to clot, you first of all measure the prothrombin time. Okay, so measure prothrombin time. You're measuring how long, so because prothrombin results can vary between labs, the international normalized ratio standardizes the results using a formula. Do you understand? Now this is the formula. Okay, so PT part is what the patient's prothrombin time, while the PT is the normal reference range that everybody should work with. You understand? So the ISI is what international sensitivity index. So this is just it. If you calculate everything and you are getting something between 0.8 to 1.2, it's normal. 2 to 3 is therapeutic range. 2.5 to 3.5 is higher therapeutic range. All right, anything more than 4 is a higher bleeding risk. Okay, so why is it important? It ensures safe and effective dosing of warfarin. It helps to access bleeding risks before surgery or procedures are done. Can monitor your liver function, vitamin K status, evaluate coagulation disorders like hemophilia and liver disease. So what are the different factors that could affect the international normalized ratio? The kind of food you eat, the kind of medications you are taking at the time. Okay, then maybe if you have an underlying liver disease or any malabsorption that can alter the clotting factor levels and all. Okay, so that was it for the international normalized ratio.